If you are being diagnosed of any health challenge, please ensure you see your health worker, your medical personnel, so that they can diagnose what is happening to you and you can take good care of it immediately before it escalates and it becomes life-threatening, before it becomes more problematic to you. And of course, don't forget to see your counselor so that your counselor can help modify your irrational thoughts to a more rational one, so that depression and anxiety doesn't set in. This is Royal Care Counseling Outreach. I still remain your online counselor. My name is Rachel. So today we are going to be talking of benign prostate hyperplasia. I talked about it in prostate cancer in my previous video. If you are new here, don't forget to subscribe to our channel and of course follow us on all our social media platforms at Royal Care Counseling Outreach. So I talked about prostate cancer, and I promised to bring benign prostate hyperplasia to your table. So today we are discussing benign prostate hyperplasia. But before we go, let's define benign prostate hyperplasia. So we are going to be talking of some risk factor of benign prostate hyperplasia. Number one of the risk factor is age. And when we are talking of age, we use the word equal to or greater than the year 50, meaning, like I said before now, it rarely occurs before 50. I put the word rarely because some rare occasions it occurs, but it rarely occurs before the age of 50. Number two is obesity. Due to the increase in the fat cells in the body, those fat cells can pose harm to the body, can become problematic in the body. So the increase in those fat cells in the body due to obesity can lead to benign prostate hyperplasia, because those fat cells increases in numbers and of course in size, meaning obesity can also lead to cancer because it also increases in number. And you know, prostate cancer increase in number, while benign prostate hyperplasia increases in size. So it can increase in the size, causing or becoming problematic to your health. So if you know you are obese, please see your health worker and of course your nutritionist, so that they can help you itemize food you should take and food you should not take. I said it in my previous video that if you are obese, please abstain from red meat. I gave classifications of red meat, and I talked about the healthy meat that you are supposed to take, which has to do with birds. That's white meat. So if you are obese, please see your nutritionist, see your health worker, and of course see your counselor. It is the increased growth in sizes of cells of the prostate. Benign prostate hyperplasia, it is the increased growth in the sizes of cells of the prostate. So here are three things you should take note of. Number one is prostate cancer is the increase in the numbers of cells in the prostate, meaning it increases in numbers, while benign prostate hyperplasia is the increase in size of the cells in the prostate. So benign prostate hyperplasia is just the increase in size, while prostate cancer is the increase in numbers of the cells. Second thing you should take note of in benign prostate hyperplasia is that it doesn't spread, unlike prostate cancer. Why benign prostate hyperplasia doesn't spread is because the cells only increase in sizes. The cells are just there, but they increase in size. Why prostate cancer? Because of the multiplication of cells, because the cells increase in number, those multiplications of cells go into different parts of the body, which makes the body to be at risk. That's why they spread, because they are increasing in numbers, they are multiplying in numbers, so they are looking for every angle of the body to relax. So that is why they are that's why prostate cancer spreads, unlike benign prostate hyperplasia, which does not spread. Then number three thing you should take note of is that benign prostate hyperplasia is equal to or greater than age 50. meaning it rarely occurs before 50. I put the word rarely because on some rare occasions it occurs, but it rarely occurs before 50. That is why I said it is greater than or equal to 50 years old. Number 3 of some risk factors or benign prostate risk factor is smoking. Smoking predisposes the cells of the body to increase in number and in sizes. So if you know you are smoking, you are at risk of having benign prostate hyperplasia or cancer. So if you know you smoke, you are at risk of having some major cancer, and of course you are at risk of having benign prostate hyperplasia because it causes the cells to increase in numbers and in sizes. So we have other risk factors, but they have to do with your hormones, such as estrogen imbalance, embiotic reawakening. We also have increased 5-alpha reductase activities and so many others, but they have to do with your hormones. Your doctor is going to talk about it for you, so see your health worker to diagnose you if you have benign prostate hyperplasia or prostate cancer. Like I said, if benign prostate hyperplasia is not properly managed, it can lead to prostate cancer. That's why I started my video with, if you know you have any health issue, please see your health worker before it escalates from being little to large, so that it's going to be you are going to be able to manage it once it's still little. So we are going to be talking of the clinical features, or you can also say the symptoms. Benign prostate hyperplasia has similar clinical features with that of prostate cancer. So I am going to list them. So if you are new here and you are yet to watch my prostate cancer, please go and watch it, so that once I am listing them, you are going to be able to go and relate it with that of prostate cancer. I'm only going to list them, I'm not going to explain. So if you are yet to subscribe, please subscribe, so that whenever we post any video and as you watch the videos, you won't be lost. You will understand where we are coming from. So in this benign prostate hyperplasia, we are going to start with number 1, irritative symptoms. And under irritative symptoms, we have little kits, which I am going to list alphabetically. Number 1 is urgency. It's in prostate cancer. Please go and watch it. Number 2 is frequency. Go and watch the explanation in prostate cancer. All these clinical features are similar cancer. That is why some clients or some patients, once they are being told or once they start seeing the symptoms that are in benign prostate hyperplasia and that of prostate cancer, once they start seeing the symptoms, they just conclude that they have prostate cancer. No, you have to be diagnosed first before you are sure of what you have. Sometimes it's benign prostate hyperplasia. That is why you have to adhere strictly to your medication so that it does not escalate to prostate cancer. Like I said, if you don't manage benign prostate hyperplasia well, it can escalate and become prostate cancer. And the C part of irritative symptom is nocturi. Go and watch it in prostate cancer, the explanation of nocturi. And the D part is urge incontinence. Go and watch it in prostate cancer so that you can understand what the irritative symptoms is all about. So we are going to be talking of number 2 of the risk factor. So number 2 is obstructive symptoms. Also have small kits under it, which I'm going to be listing alphabetically. Number 1 is weak stream. It's also in prostate cancer. That's why, like I said, I said once they start seeing all these symptoms, they just believe it's prostate cancer. They have similar clinical features and similar symptoms. So that's why people believe it's prostate cancer. Sometimes it's benign prostate hyperplasia. So under obstructive symptoms, number B, or the B part of it, is existency. We also have feeling of incomplete emptying. So the D part of it is straining. The E part of it is intermittency. I'm going to explain intermittency because it doesn't have similar features with that of prostate cancer. So intermittency is not in prostate cancer. So that's why I'm going to explain intermittency. Intermittency is when you are urinating and your urine is stopping and coming. You are peeing and you discover that you pee a little, it will stop. After a while, it will come. After a while, you continue. Your urine is stopping and coming. That is the meaning of intermittency. So that's the only symptoms that is different from prostate cancer. So now we are going to be talking of the treatment of benign prostate hyperplasia. So under the treatment, we have treatment plans such as IPSS, that's International Symptom Score. We use it to determine if the benign prostate hyperplasia patient should be placed on some medications or it should be placed for immediate surgery. That is a plan used to diagnose or to know which treatment the patient needs. We also have other treatments that helps the benign prostate hyperplasia. We have watchful waiting. It's closely related to what I just said now. You are observing, you are watching, you place the patient on observation, you place the patient on watch to know if the medications are actually effective for the patient or he or she should go for surgery. We have medical treatments, that's medication and other treatments that can be given to benign prostate hyperplasia. Your health worker will expatiate. And the last but not the least is surgery. So surgery is being carried out to help the benign prostate hyperplasia. The essence of this awareness is to help you to be cautious of yourself, so that once you have any health issues, you don't relax and allow it to extensively cause or to extensively become problematic to your system, to your body system, or extensively cause a life threat to you. It doesn't become life-threatening. Please, if you are passing through any health challenge, see your health worker, and of course go for counseling section with your counselor to help you. So as a counselor, once you see that any patient is coming to you and it's health related, please, referral service should be done, and after referral service, counseling sections can now continue. I come to the end of today's outreach. In my next outreach, we are going to be talking of vasectomy, that's permanent family planning for men. I am going to be enlightening us on vasectomy. I still remain Royal Care Counseling Outreach, and my name is still Rachel. Bye bye.